Hi everybody, I'm Dr. Amir Karam. I'm a board certified facial plastic surgeon and I specialize in facial rejuvenation, and I've been practicing for 15 years. And during that period of time, I get asked this question over and over and over again. And that is, why do so many celebrities look unnatural? Why is it with all of their resources, with all of their financial connections, etc., why is it that they look the way they do after some plastic surgery? And how am I supposed to expect to look natural? So as a result of that observation, so many of you out there question whether or not you should be doing facial rejuvenation surgeries or plastic surgery, etc., because you assume if they can't get it right, how can I get it right? And it's a very, very good question, and I'm going to help break it down and help understand why that might be the case. Starting with what looks natural. Natural basically is defined by something that occurs in nature. So a facial feature, once it is disrupted in one way or another that doesn't belong to the human species any longer, that doesn't look like it does in nature, we immediately recognize it as looking off, and our assumption, and usually right, is it's a result of plastic surgery, because otherwise the facial feature would look like everyone else. It might be more aged, it might have a larger nose, it might have hooded eyes, but it looks like every other hooded eyes and every other larger nose and every other aged face. But once it becomes a deviation from that, then we know it's a result of plastic surgery. And the second you look at somebody, I mean, you could be in a restaurant and the person walks in a split second, you can tell that person has had work done because they no longer look like everyone else in the room. Now, for all of you who are worried about this and who wonder if it's possible to create natural looking outcomes, I'm going to say this. In that exact restaurant, in that exact room, that there is that one person that walks in that looks very unusual, there could be 2 or 3 people dining and looking like everyone else, and they've had work done and they look totally normal, natural. So I don't want you to be scared of the procedures, but I want you to understand why it happens and how to avoid those things from happening to you. When we look for a surgeon to operate on us, what do? We ask our friends, we ask various connections, people who've had work done. And what ends up happening is one surgeon who might do an amazing job on breast augmentation or liposuction, for example, that person might not be specialized in facial rejuvenation. I mean, this category of surgeries where you restore somebody's youthful appearance is really a subspecialty within plastic surgery and facial plastic surgery. So what ends up happening is you ask your friends, who do you know, who do you trust? And your friend might have had a beautiful experience and a beautiful outcome with a breast augmentation or a liposuction or tummy tuck or any of those procedures, or even rhinoplasty. And then they give you the name. So you take the name, you make an appointment, they're board certified, they meet all the criteria, they have a great reputation, and you're like, this is a solid person. But what is usually missing is the knowledge that that individual may not be a specialist in that particular procedure that you're interested in. Now I'm going to give you a quick story on this situation. So years ago, a good colleague of mine calls me up and he says, hey, can you kind of walk me through a facelift? How you do it, what are the techniques, etc. And I said, yeah, I'll be happy to, but what's going on? He said, well, I had this news broadcaster and they want to have a facelift with me. I said yes, and we planned it. It's going to be in a couple weeks, and I wanted to make sure that I'm doing things the right way. I said, hey, how many of these have you done? And he said, basically, I do 1 a year. I've done 7 since I finished my surgical training. So I thought to myself, wow, this person who literally sits in front of thousands, millions of people in a prominent market is about to undergo facial rejuvenation procedure with a surgeon who does 1 facelift a year. Now that's a scary thought. I think for a surgeon like myself who literally does every single day of the week, sometimes 2 in a day, I mean, we're talking like 30, 35 of these cases a week. We're talking about a person who does 1 and is asking how to get it done. Now, I said, why are you taking on this case? He said, well, I didn't want to say no because this is a prominent person, it's good for my reputation, etc. But it's an ego boost when a celebrity comes to you and wants you to do their procedure. The outcome is never going to be great when you're dealing with an occasional surgeon doing those type of things. The worst thing you can do is just go strictly on a name given to you, or out of convenience because you live in a community and there's a surgeon in the adjacent area, and you're like, okay, I'm going to go to this person because I don't want to get in the plane and travel. I'll tell you, in my practice, I would say 75% of our patients are from outside of the state and even outside of the country. And I applaud these people for doing their homework, for their willingness to stay a week or a week and a half outside of their homes, recover. But what they're getting in exchange is basically a guarantee that they're going to look normal and natural and they're going to look fully rejuvenated. So it's worth that type of investigation and detailed research to make sure that you're going to be safe, because fixing those problems oftentimes are more difficult than getting it right the first time. It's not always easy to restore those. Now, what's the right way to approach seeking a surgeon? You got to do your homework. So number one, make sure obviously the basic credentials are there, board certification, et cetera, et cetera. But then the second thing is you got to make sure that the particular surgeon that you are interested in is actually a specialist in the procedure that you're interested in. So whether you're getting a rhinoplasty or whether you're getting facial rejuvenation to a facelift, eyelids, fat transfers, et cetera, you want to make sure that person is living, breathing, and doing this every single day. That's a huge aspect. Number three, you got to make sure you like the outcomes. And what that means is you got to look at the before and afters. It's super easy. You just want to see 50, 100, however many before and afters, and you got to see consistency that in fact they create a beautiful outcome and the results are natural looking and they kind of fit what you feel is an acceptable outcome for yourself. So when you put it all together, it's pretty straightforward. It's not always easy to find that surgeon, but it is easy to vet them, right? I mean, a picture is worth 1,000 words. You look at the before and afters, you make sure they're consistent, you check their reputation, and then you have an opportunity to say, all right, I narrowed it down to this. And finally, I think what affects a lot of celebrities is a misdirection in terms of treatments. We see a lot of bloated faces. We see a lot of cheeks that are overfilled. We see a lot of faces that look chubby and unusual looking. And that is because that particular celebrity chose to pack their face with fillers and go the non-surgical route when in fact the proper, appropriate treatment is to do a vertically oriented facelift that will give you a restored look without looking overfilled. Everything that I'm saying here, it's not specific at all to celebrities. Obviously, we see it everywhere. We see overfilled faces, cheeks that look like they've been through a wind tunnel. We also see eyes that don't look right, they don't close, etc. It happens everywhere. We see it everywhere. I can't speak for every celebrity out there and what exactly happened, but this is the general kind of logical direction that things go in and why things go awry. There's a lot of celebrities out there that have had plastic surgery, that have had beautiful looking outcomes, and you would never know it. They just look like they're not aging. So if you see somebody who's in their 50s and they look great and they look like there's no laxity and they look vibrant and youthful and they're not aging, they've had work done. It's incredibly difficult and incredibly uncommon for somebody who's in their early 50s, late 40s and beyond to not show signs of aging. I don't care if they claim that they've never had surgery or attest that it's because of olive oil or some other type of basic remedy. For some reason, socially, we are, I should say, not super open about something that we should be open about because it's a shared concern for a lot of people. I think really at the end of the day, celebrities should express what they've had done and things like that, or at least not deny it. Because I think the denial gives everyone else the impression that you're aging in an unusual and unfortunate way, and these stars are just blessed with some type of God-sent genes that they're not aging, but that's generally not the case. And I think nowadays we're starting to see more and more celebrities coming forward and expressing things, and I hope that trend continues because at the end of the day, a lot of us kind of look to the celebrities as role models or whatever you want to call it, and I think it's good socially for that trend to continue in that direction, and so I'm pleased to see that that's happening in that way. So those are the general stories. One, celebs are getting beautifully done work, trust me. Two, celebs are oftentimes misusing treatments just like anyone else would with the use of non-surgicals, and ultimately they're choosing the wrong surgeon and the wrong technique, and And those are the reasons why so many that we know of have the outcomes that they do. So I hope that illustrates and explains this very common question. I've probably been asked this at least 1,000 times, and I don't want you as the potential person who is concerned with your aging changes to be scared just because of what has happened to another person. If you do your homework right, research, etc., you will find surgeons that can do an incredibly beautiful job. If you don't believe me, just look on my before and afters and my Instagram, etc. You'll see tons and tons of very natural looking outcomes, and that's how it can be done. So thank you so much. I hope this helped answer a question. I encourage you to send this along to friends and family who would find this information interesting and enlightening. Please make sure you subscribe to this channel. I present information like this once or twice a week. If you loved it, hit like and drop a comment if you found this interesting or if you have any questions. I'll be happy to answer them. Thanks so much, and more to come. Dr. Karen.